Good evening, everyone. How are you? Hope you're doing good. Today, I'm going to talk about one of the important topic that is reversing prediabetes without weight loss, the role of glucose control and fat distribution. Is it possible? Yes, it is possible. Let's go into this interesting topic. So we know that the prediabetes affects more than one third of the adults, and it represents a critical opportunity to prevent the development of type 2 diabetes. So if prediabetes is left unmanaged, what will happen? Nearly 70% of the individuals with prediabetes may progress to over diabetes. Then what will happen? It will increase the risk of complications like increasing the risk of cardiovascular disease, kidney damage, and neuropathy. While conventional prevention strategies they have emphasized the weight loss, but now the emerging evidence highlights that improvements in the glucose regulation and insulin sensitivity they are more important than the body weight changes. So a landmark study published in the Nature Medicine, they conducted by researchers at University Hospital Tübingen, what they demonstrated that pre-diabetes can be reversed through lifestyle interventions even in the absence of significant weight loss. So participants, those who achieve remission, how will you define the remission? The remission is defined as normalization of the blood glucose after 1 year. Such participants, they showed an approximately 70% lower risk of developing type 2 diabetes over the subsequent 5 years. So importantly, what we have to note that the metabolic improvements observed were not linked to overall weight reduction, but to favorable changes in the body fat distribution. So individuals who achieved remission, they demonstrated reduction in the harmful visceral fat. Your visceral fat is harmful, so they demonstrated reduction in the harmful visceral fat. And there is relative increase in the metabolically protective subcutaneous fat. So there is increase in the subcutaneous fat. So what it leads to? It leads to improved insulin sensitivity and preservation of the pancreatic beta cell function. So these findings emphasize that the glycemic status is more closely related to the fat distribution than to body weight alone. So what doctors advise? You have to do regular physical activity, adoption of fiber-rich dietary patterns like Mediterranean diet, DASH diet, and adequate sleep and stress management. They were the key components of the lifestyle intervention that you have to follow to reverse prediabetes. So overall, this evidence supports the paradigm shift in the prediabetes management, focusing on the glucose normalization and metabolic health rather than the weight loss alone. So it offers a more sustainable strategy for long-term diabetes prevention. Thank you so much for your kind attention and kindly share my lecture to your friends.